Hello, my name is Anjali Dsouza and I'm the Medical Director at the District Center for Integrative Medicine. Today I wanted to provide a top-line sketch of why your experience here at an integrative and functional medicine clinic will be very different than your experience at a conventional medicine clinic. This is just a brief sketch, so please take a moment to go to our website if you want to learn more about our specific offerings or even look into your condition so that you can understand what it might look like for your particular needs. So if we think about your experience here at DCIM, one of the first things that you will notice is that we're interested in your entire body. Instead of a typical practice where you might find yourself in a neurologist's office if you have a headache or a gastroenterologist's office if you have GI complaints, here we want to know about all of it. So if we use this example, it might be that what's happening in your gastrointestinal tract is actually causing your headaches. So we're curious about the interconnectedness of systems in your body. Beyond just focusing on the whole body, we also take the approach that we want to understand the cause of your discomfort as opposed to just think about symptoms. So here, if we use an example, we can think about depression, right? So sadness is a symptom. And if you are sad, you could be given an antidepressant. That may not be a bad choice, but what we might be curious about are what are all the things that may be driving that symptom. So is it a vitamin deficiency? Is it a hormone imbalance? Is it a gastrointestinal inflammatory process? When we do this, we're able to kind of address what the root cause of your issue may be, and then allow you to potentially have less pharmaceutical burden as a result of this. Our goal is really to optimize your quality of life and not just think of you as an ICD-10 code, which is essentially, what is your disease, right? We want to know what matters to you. What do you want to be able to do? Not just change the laboratory values, but how do we allow you to have the most optimal vital function in your body? And an example of this might be that you feel fatigued, but your laboratory markers all look normal. So our job there would be to say, your quality of life is really negatively impacted by your low energy. What can we do to help? This intense focus that we have on you is really evident from the beginning. Your first appointment is going to be 90 minutes long, and that's in comparison to what is usually a 12-minute typical intake appointment in a medical practice that is conventional. This is a time for us to essentially go through the history of your life from the time you were born until current day. And in doing this, we're able to map out where there are vulnerabilities that we need to be more curious about. Is it stress? Is it food? Are there toxic exposures? What is driving some of the chronic issues that you're presenting with? Whenever possible, we are going to try and prioritize natural interventions over pharmaceutical ones. All of us have trained extensively in nutrition as well as nutraceuticals so that we can offer you high quality support and not necessarily always rely on pharmaceuticals. And it's not to make one bad and the other good, but the truth is pharmaceuticals do have more side effects, and especially if you are laying on multiple medications, you may end up having worsening quality of life as a result of those multiple medications. So we really like to prioritize natural medications for that reason, and additionally for the reason that our job is to incline the body towards healing, which we fundamentally believe is possible, as opposed to potentially slamming it into the place where we want it to be. This approach means that you're going to get a deeply individualized experience as opposed to kind of more of a cookie cutter algorithm experience when you might go to a conventional practice. And this allows for you to have a very kind of unique and deeply connected relationship with your provider, who is going to understand who you are and your goals and your desires. It's a beautiful experience. I feel incredibly grateful to have these meaningful relationships with patients. So in conclusion, this is just a brief overview, and I think it allows you to see some of the main highlights of what might be different in your experience here. But if you're intrigued or if you're curious, I do encourage you to reach out to the practice and have an individualized assessment call with me to find out if this would be a good fit for you. Thanks for listening.